A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome to the PEMF podcast, and this is episode 17.
And today we're going to be talking about polarity, because polarity when it comes to PEMF can be a little bit of a confusing subject because it's not really that spoken about in a lot of PEMF devices or in the PEMF world, really. And we did actually get a question, I think 2 episodes ago now, about polarity. So this is going to be our full kind of deep dive on it and how it affects PEMF. So what polarities are there? What kind of polarities are there? Are there loads? Are there 2 or 3? What is it?
Yeah, so to keep it nice and simple, there's only 2 polarities when it comes to magnets, and it's exactly the same as the magnets you used to get at school in the science class. You used to have a north with a little N on, and the south with the little S symbol on it. So you'd have a north and a south side of a magnet, same as static magnets. Pulsed electromagnetics have the same polarities. So there's only 2 to consider. And if you're watching this podcast, you'll see that I've got my phone in my hand now just to give you a little description. But actually what happens is you get the north come out one side, it goes around the coil and it comes in the other side. So it's just literally same as the poles that you would get from the Earth's magnetic field. It comes out the North Pole, around the Earth and back into the south side.
Okay, great. So now we know there's only kind of 2 polarities, north and south. What effects does these have in the devices? Is north maybe better for some stuff, or is south better for some stuff, or is there no difference?
So it's a hot topic, and it's argued quite often when it comes to PEMF therapies. Our summary is that really it doesn't make a huge amount of difference. There's been some studies, there's been some kind of evidence base into it to find out whether it makes a significant difference. We found some stuff online that was saying that north is better for pain, south is better for sleep. But from experience and from using these devices and from customer feedback, it really doesn't make much difference. We tried digging into it a lot more online, and it's very confusing. And I think the biggest one that we can pull from is from Dr. Paulick's book and from the evidence he's done from all his research. And he again is one that follows our feedback, and that it's that the north and the south polarity have very similar effects on the body. When you're looking at the PEMF, the way in which it works is it, like I just showed, is that it comes out one side, goes around and in the other. The magnetic field doesn't change. It doesn't have any different properties when it comes out the north and goes back into the south. So we would say, the more important thing is to get the device close to the body, and so you're pulling from the intensity of the device and you're using the frequencies, and not to get too wrapped up within the polarities of the devices.
So before this podcast, you mentioned something about the sandwich effect, and the sandwich effect has a little bit different kind of effect on polarity. Can you just kind of maybe explain what the sandwich effect is, and then what the polarity effect is for that?
So sandwich effect is quite a new thing actually, and it's to intensify PEMF therapy within a sandwich effect, and it tends to be on much higher intensity devices, but you do get sandwich effects from lower intensity devices too, and I'll explain how that works. So what we're effectively, imagine in your head now a human sandwich. You've got a mat at the bottom, so you've got a full body PEMF mat at the bottom. You've got the human in the middle is the filling, and then you've got another mat on top or a small applicator on top. So a lot of devices come with a full body mat and a small applicator, and that is kind of the basis to a full body package with a localized applicator. And actually, if we want to make sure they are the most effective we can, then it does become a little bit more important with the north and the south side. So what we want to do is we want to put the body part or the human or whatever it is in between that system, and we want to make sure that you have the same polarity facing the same way. So you don't want to create an effect where where the magnets are rebelling each other. So we go back to those science magnets again, and if you put 2 south sides together and push them together, they push apart. Same sort of things happening in a PEMF system. So if you put a full body mat on the bottom, put someone in between, and you've got the north side facing up and the north side facing down on the two applicators, you create a little bit of an argument and confusion in the middle of that system. So actually what you want to make sure you have is north side facing up on the mat and north side facing up on the second mat. So you're actually getting an effect where the magnetic field is just going through the body up and round again, like it would if you was just using one applicator. So some devices, they do indicate what is north side and what is south side. If it's not very clear to you, you can ask us and we can explain it to you. Give an example on the Celerate device. It says in the manual which side is north and which side is south. And you can actually change that in the menu. So some PEMF devices have a user selectable north and south side. And the reason they do that is, like I say, if you want to use it in the sandwich effect and you want to make sure that both polarities are the same, then you can switch them around. The other way to do it, if your device doesn't have a setting to change the polarity, is just flip the device over. So if you've got a full body mat and you know that one side is north and the other side is south and you want to get it the other orientation, you don't necessarily have to do it within the settings. You can flip the applicator or flip the device on its head and you'll actually get the other side.
Okay, great. So from that then, being able to change the polarity in a device isn't a massive deal breaker if the device doesn't offer that.
Yeah, exactly. So the biggest thing really is that the device is indicating what side is the north side and what side is the south side, because you do get devices that don't indicate it because, like I just said, it's not a huge issue. But if you're trying to create that sandwich effect, it's not so important to have a device that you can switch around in the menu system, whereas you can just switch the applicators around as long as they indicate it.
Okay, brilliant. If you do have any other questions then when it comes to polarity, or you may be confused on any subjects, if you just leave us a comment wherever you're listening on, or even drop us a message, we'll make sure to get back to you and answer that. And we might even answer it in our next episode of PEMF Talk, where we answer your PEMF related questions. But if you are, no matter what platform you're on, Apple, Spotify, or even Amazon, if you could please leave us a 5-star review, that'd be massively appreciated. And if you're on YouTube, please drop us a follow or subscribe, I should say, because the more you subscribe and leave us 5 stars, the better the episodes get and the better the guests get.
Thanks again for listening and tune into our next PEMF podcast.